Okay, so Damla, I have a screen. Can I
Yeah.
see you briefly? And then your full name, video. Let me turn my video on.
Okay.
Turn yours on briefly. And then your full name, please. Your video on fully, please.
Is my video can you see me
Yes,
now?
yes, I can see you. And
Okay.
then type your full name in the chat room for me, please.
I don't know where. Oh, chat. Okay, yeah. My full name is Sola. That space. Sola Isiroshu. That's my name.
Amazing. So it's okay. Now you can go off the video. It's fine. And then I can also go off. All right. Now, tutorial. So tell me, which area do you want?
Mm.
Which area?
I just wanted to give me some summaries because I've actually done it, but I just want some brush up on it because
Okay. So
I'm on the assignment for health and is it
yeah. So since the tutorial, if you can tell me which area, so you want me to recap or what? What do you want so that I can before we go on to the next one?
just a summary on the assignments and everything.
The assignment itself.
Yeah.
Okay. So can you see the screen?
Yes, I can.
Okay, you've done assignment 1, 2, 3. Have you done
I've
both?
not, I'm almost done because I've not finished it. So because I submit my assignment every Monday. So
Okay.
because I use 2 weeks to do one assignment because I work, so I use my half time, which is Tuesdays and Sundays, to you know do the assignment.
Okay.
So
So have you done unit 1 assignment?
yes, I'm actually on the last unit.
Uh, Which is
So
unit 3 or unit 4?
yeah, unit 3.
Has it been marked?
No. I've not. I've said I will be submitting it on Sunday.
Okay.
I'm I'm done with the whole assignment. Just making a reference for the health and safety assignment.
Oh, the health and safety assignments. Okay.
Yeah.
Okay. So so let's look at assessment criteria.
Mm.
This is more to do with we the assessors, but to get understanding of what you expect from you is you have you have something like summarized legislations, policies, and procedures. Understand how health and safety legislation is implemented in health and social care settings. Then the 2 is understand the role of risk assessment.
Yeah.
And the 3 is understand the monitoring and review of health and safety in health and social care. Okay,
Mm.
if you look at point 1, point 2, point 1, 3 for the first one, 1, it has summarized, 2, it has examined, and then 3, is that what you have?
Yes.
And then 3, analyze
The health
health
and
and social
safety
care.
priorities for a specific health and social care
Now,
settings.
anytime you hear the word analyze, what comes to your mind?
Because I've been doing it, so I just explained like I write a full details about something.
But the word is analyze.
Yeah.
Mhm.
Yeah, like writing a full details about something.
Okay, let's go. Look at this. You are required to write a report within a health and social care environment which should describe current legislative requirements,
Mm.
regulations, policies, and procedures.
Yeah.
reporting systems, organizational structures, roles, and responsibilities, health and safety priorities for a specific health and social care setting.
Yeah.
Examples of monitoring and review systems such as accident to incident logs,
Yeah.
inspection of requirements and reports, infection control. So let's limit ourselves to task 1 out of 3. You've done this already, haven't you?
Yes. I
Mhm.
have.
Okay, so like 1 minute, please. Listen. Good. So if you look at if you look at um you are meant to have 1,500 words submission in a
Yeah.
report. It should include diagrams, references, and appendix. You know the type of reference, Harvard reference, don't you?
Yes. Yes.
Did it include any diagrams?
No, I didn't include any diagram on
It
that.
didn't include any diagrams at all.
Yeah.
Do
Just the
you have?
reference.
Mhm. You could not include any diagrams at all, but it's a report.
Yeah. I didn't include any diagram.
Couldn't couldn't. Why?
No.
There's a lot. Why, please?
See.
Okay. So did you struggle to include diagrams? Because why am I saying this? You see, your report should be within health and social care environment. We should describe current legislative requirements, regulations, and policies and procedures. So
Mm,
then reporting system. So what are some of the current legislative requirements? Let's take CQC. Okay.
yeah. Yeah.
Let's take CQC. What is the role of CQC as a regulator? What's the role of CQC as a regulator?
Sorry.
CQC. You know CQC, don't you?
Yeah.
What was their role?
For the safety, you mean that they imply the nurse they imply nurses within health and context with handlings of materials and all that.
Yeah, but you see, CQC ensures that organizations are conform to various compliances that they need to. One includes even health and safety. Okay,
Yeah.
safeguarding. Do you know about CQC?
Yeah.
Okay, and we also know about the health safety executive. You know about them, HSE.
Yes.
You know about them as well.
Yeah. Like the control substances of harmful
What we
substances
call
that
COSH. We
affect
call
health.
COSH.
Focus.
COSSH. Yes.
Yes. I think they are designed for employees to explore hazard substances such as cleaning agency and all
What agency, please?
for cleaning.
Cleaning.
Yes, cleaning and medications. They are in charge medications too.
Yeah, but you see, I think the question is You are to report within a health and social care environment, which should, you see, you have to have a detailed report within a health and social care environment, which should include or describe current legislation requirements, regulations, policies, and procedures. So you need to identify some current legislative that you covered in your units, okay? And I'm saying, what are some of the legislative requirements? Health and safety legislative is one of that, isn't it?
Yeah.
Fire safety, isn't it?
Mm.
Did you learn about that?
Yeah.
Good. Those are current fire, and what may be the policies in place. Your policy, when we say policies regards to fire safety, the policy should clearly be identified that when you hear the siren ring 3 times, what does that mean?
It means there is an hazard.
Amazing. Amazing. And so you have a legislative and there should be a policy. Now, what happens is the legislative is normally the regulator. You understand?
Yeah.
Is the regulator. And one of it is the health and safety executive. One of it is the CQC, and you name them. So they are the regulators. But then you, as an employer, you need to have a policy to meet what the regulator needs. Okay,
Yeah.
you understand me?
Yeah.
Good. So if there is a fire safety, it is required that every organization should have a fire safety policy. Yes or no?
Yes.
Good. And one of it is your employees need to be trained on these fire safety formalities and training, which includes when the siren rings 3 times, you need to
Yeah.
find yourself to the nearest assembling point or the master point.
Yeah.
And those master points, when you are employed, they need to show you, isn't it,
Yeah.
where they are. You need to have those orientation. But health and safety includes all other things. Health and safety towards yourself and your employees. You understand?
Yeah.
So if are you a carer?
Yes, I'm a carer.
If you're a carer, you have a duty of care towards yourself and the client or service users that you are taking care, isn't it?
Yes.
Good. And so when they say current legislative requirements, what are the requirements for health and safety? What are the requirements for health and fire safety? And then you also mentioned policies for COSH. Those are only for controlled, okay?
Mm-hmm.
Controlled, yes. Those are how to control of substance as hazardous, okay? And that is why you
Yeah.
learn about gas, type of fires, and those gas and those you have to put on apron, PPEs, and all that.
Yeah.
Do you understand me?
Yeah.
And so, what they expect you to bring they want to see your understanding in those things. Current legislature, you have to name the legislature and then find out the requirements for those legislation. One of it is a policy for RIDDOR. You know about RIDDOR?
Yeah.
What's that, please?
Riddle.
Yes, please.
Um, I think this is they provide they regulate the report of work related to injuries and diseases by health and um for health care providers
Yeah, it's
for
not the regulate, but it's a policy.
yeah.
It's a policy incidents. So it is there. Look at that. It says give examples of monitoring and review system such as accident and incident logging. Have you seen that?
Yes.
Inspection requirements and reports and infection incidences. As a carer, when somebody slips and falls down, where do you report them?
As a carer, if someone fall down, we call the if somebody fall down, we call the emergency this which is the ambulance.
But before, yeah, you call them, but you also record them, don't you?
Yeah.
Exactly. It must go into the incident book, isn't it?
Yeah.
An incident has happened. So it needs to go into the incident book. And that's what we call, it all comes under reader. Reporting of,
Reporting of injuries, diseases, and dangerous
thank you,
occurrences in relation.
thank you, thank you. So these are some of the policies that they want to see you arguing your way, and but then also saying the procedure, okay?
Yeah.
Procedure in reporting them. The procedure, one of it is people's privacy, health and safety, legislations, data privacy, okay?
Yeah.
Or the GDPR, you know about that, don't you?
Yeah.
Okay. So these are all part of data bridges that you need to protect the service users and
Mm.
the kind of information you have in the office. There should be data protection. Those are all current legislation. And what are the procedure? There should be password to every computer. Documents should be properly filed and protected, isn't it?
Yeah.
Exactly. And then there should be privacy as well. And then there should be confidentiality. Okay.
Yeah.
Who do you report when you have issues with your colleague at work? What do you do? And who do you report to?
I call the office to report any incident to them.
About if you have any concern about your colleague at work, what do you do in the first instance?
That's what I'm gonna do. That I'm gonna call the office and report any incident for, which is the owner of the company. I mean, people in charge, the assignment that we.
Every organization has either a line manager or a supervisor or a team lead, don't you?
Yeah, a supervisor.
Okay. But you can never, the best practice is that you can never inform or complain or report a colleague to your line manager when you have not spoken to your colleague. Your first, that's what you have to do.
Mm,
Okay. Okay.
yeah.
If you have concern about your colleague at work, the first instance is to approach the colleague and raise the concerns. Then, if after the colleague is not changing, the behavior is still getting worse, then you can inform your line manager. Okay.
Yeah.
This is how. So it says reporting systems, organizational structures, roles, and responsibilities. When we say organizational structures, we are talking about the chronological order. You understand?
Yeah.
Who is in line in charge? Line manager, name them, team leader, and all that. So they are
Mm,
organizational structure and the responsibilities of each person in the structure. Obviously, if you have any concern about food, okay, then you have to talk about the kitchen staff, isn't it?
yeah.
Exactly. There is also talk about the health and safety priorities for a specific health and social care setting. Every setting may have its own health and safety priorities. For instance, if you have
Mm,
a setting that involves quite a number of older residents, then there will be high level of safeguarding issues and concerns because a lot of them, older people, cannot um, walk or something. So the risk assessment in that place should be very rigorous. In that, the care setting may need quite a number of workers for 24 hours care. You agree?
mm-hmm.
You understand me?
Yeah.
Good. So the health and safety priority for a specific health and social care setting is very crucial. There's care settings that may need 24 hours carers every now and then. And there are some that may need somebody coming only morning and evening. Okay. You understand me?
Mm,
Based on what the health and safety assessment that was undertaken. Those are some of the things that in your assignment submission you need to be looking into. Okay.
Yeah.
Any more questions, please?
No.
So what have you done? The ones you did, how did they look like?
Yeah, I used to have diagrams for but I just feel like this one doesn't really need diagram
Doesn't
because
need them. That's fine.
yeah,
That's fine.
because I explain it. I put every details concerning because this
Did you?
assignment is I think is one of the simplest one I've been doing so far because I it explains more about what we do at work and all that, especially for the reporting systems, organization structures, roles, and responsibilities. So, and I explain about health and safety priorities in the hospital settings. I explains about monitoring and reviews of and review systems, monitoring and review systems, and I just make sure all my points are very clear and
Precise.
yeah.
Amazing. 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 But it says your report should be no more than 1,500 words, excluding diagrams, references, and appendices. Is that what you did?
Mm-hmm.
Amazing. Amazing. So let's look into tax 2 then. It all depends
Yeah.
on the wording. If they say explain, then you need to be very analyzed. You need to be very, you know what I mean?
Yeah.
Hmm. You need to be very deep, analyze. You have to analyze it and very well. Uh-huh. So let's look at tax 2. Today we are doing tutorials, isn't it?
Mm-hmm.
Tax 2, risk assessment. You've had that lecture, haven't you?
Yeah. We have a risk assessment. You want me to read the instructions out?
Yes, you can.
You are required to show that you have a clear understanding about the rules of risk assessment in health and social care services provision. So, within the reference of the principle of risk assessment, undertake a risk assessment relating to one aspect of health and safety policy in health and social care practice. A risk assessment should explain the principle of risk assessment and examine how risk assessment inform care planning.
Amazing. What's your understanding?
Like
What's your understanding on what
understanding,
you have just read?
it just they want us to talk about risk assess or what we know about risk assessment.
Hmm.
Yeah.
But what role does risk assessment play in the care service? What role?
It's just an understanding for you to make sure that um the care provider is in a good hands. Yeah, and
Why
there is
do,
not
in the first place, why do we do risk assessment?
to know if the client is in a good position to receive service or is in a good space for service,
Is that all?
and to make sure that there is nothing like risk around them or
So that
something that
nothing at risk out
that
there.
can
What's the right word to
affect
what's
their
the right
health,
word to use?
like to make sure there is no hazard around them.
Amazing. These are the things we expect to see in your submission. You understand?
Yeah.
You cannot receive, you cannot repeat the same risk. Okay.
Yeah.
We should see things like hazard, or more importantly, safeguarding.
Or manual handling.
You understand?
Yeah.
Safeguarding. That essence of risk. Risk is what? The likelihood of what? To occur, isn't it?
Yeah. Yeah.
So you are sort of trying to prevent or minimize, isn't it?
Mm-hmm.
Those hazards or those safeguarding not to occur.
Yeah.
This is why you can tell that a service user or a client may need to use Zimmer frame or may not need Zimmer frame, isn't it?
Yes.
Why? Why?
Why?
Why can you tell that a client may need a Zimmer frame or not?
We can ask them to try to walk, and if you see they can't walk very well, or if you see they can't walk very well, then we have to provide them a frame to assist them in walking.
So
And
that thing that you do, what's the name? What's the right word to use? What's the right word? That thing that you are talking about. It's called
uh
assessment,
yeah,
isn't it?
yeah,
Hmm. Assessment. Am I right?
yes.
And that's what we call risk assessment.
Mm,
We do those assessments so we can tell the needs, isn't it?
yeah, we call it physical assessment.
Hey, you're adding some to it, is it? You are laughing.
Oh, like physical now, because even assessments, I think at work they said is divided into two. We have the physical assessment and the environmental assessment.
Can we also have emotional assessment?
Yes, there is emotional. I think it's divided in so many. Assessment is divided in so many ways. We have the physical, the environmental, emotional, like you said, and many more that I can't remember. I want to
Okay,
mention.
amazing.
Yeah,
Amazing. So this is why we do risk assessment. So that the carer also is going to work with the person who understand, isn't it?
yeah, they will be able to identify where the hazard is
Good.
from the assessment.
Where do you normally find this risk assessment? Where do we find them?
No, well, sometimes we usually stay with them while they ask those questions and do the assessment. And sometimes we can find it on our app, which is the app we use for working to know if it has been carried out or not.
But where exactly in the app? Do you know about care
Where
plan?
the Yes. No, we on we have different app for care, because we are using Betty, so we go on that risk assessment files and know what it has been written on it. Or there's a place where they discuss it on our own app, which is Betty,
Okay.
because there are lots of apps for cares.
Okay. Amazing. Amazing. So per risk assessment, we can tell that a service user or a client may need two people, isn't it?
Yeah.
To help them to go and bath, isn't it?
Yes.
Or not, exactly. So all you are preventing is preventing harm, danger, as you said,
Yeah.
the environment and all that. That's the essence of risk assessment.
Yeah.
Mhm. Amazing. Amazing. And so you are required to show and you have a clear understanding about the role of risk assessment in
Mm-hmm.
health and social care service provision, isn't
Yeah.
it?
Yeah.
Clear understanding. So
Yes.
how was your approach when you were trying to answer it? How did you approach it?
First of all, I talk about what risk assessment is all about, which is I talk about what principle of risk assessment is all about. And yeah,
Is that all?
and I talk about the applications of risk assessment. I talk about how risk assessment inform care planning.
Mm-hmm.
Yeah, that's all.
Amazing. No advantages and stuff.
Because I was not asked to talk about the advantages. I was only asked to talk about I was only asked to
You say show your clear understanding.
Yeah, that's why I said I talk about the applications of risk assessment. What?
Mm-hmm.
Yeah.
Okay, so it says that understand a risk assessment relating to one aspect of health and safety policy in health and social care practice. Undertake a risk assessment relating to one aspect of health and safety policy in a health and social care practice. Did
Yeah.
you see that, please?
Yeah.
What's your understanding of that?
Sorry,
Should I repeat
can you say
myself?
that again? Yeah.
I says with reference to the principles of risk assessment, which you said you did, right?
Mm-hmm.
Undertake a risk assessment relating to one aspect of health and safety policy in in a health and social care practice.
Yeah. Yes, that's what I talk about on the applications of risk assessment.
Okay, you
I
did,
spoke
right?
about yes, I spoke about the manual handling.
The manual
Like
handling, did you?
okay, this is what I on the applications of risk assessment. I said
Mm-hmm,
manual handling is residential care home will be
mm-hmm,
used to provide a context for the applications of risk assessment.
mm-hmm,
Yeah, and the moving of patients with the limitations of their mobilities in common in care environment and maybe elix for injuries. If it's
mm-hmm.
not carried out, the environment if it's not carried out, if it's may lead injuries if it's not carried out. Like I explained about why the risk assessment is needed. Okay, why? Okay, that's an advantage of it. This implies that care workers are faced with high risk if the risk assessment is not carried out on the on the I'm trying to remember the
Mm-hmm.
good yes,
Are we together?
yeah, carry that. Like I talk about I said this implies that care workers are faced with the high risks of injuries from carried out, and these activities will benefit the service. This
Uh-huh.
may also be harmed from falling through improper movement, like, and that's where the SEMA frame comes in.
The same affair we spoke about.
Yeah, it estimates the steps of risk assessment.
Good, but my concern is were you able to do a proper, as I say, examine how risk assessment informs care planning? So the should explain the principles of but then also in addition explain how those risk assessment informs care planning. Were you able
Mm,
to do a proper examination to that?
yeah,
You did as well.
yeah.
Good, good, good. And in examining how it informs care planning, what was your approach?
Um, the process of risk assessment does not intimate the desired outcome
Mhm.
independently.
Okay,
Okay, so therefore, it will be required to contribute efforts of developing and reviewing individual care plan.
okay,
The indication of risks are specific in a certain patient environment and care providers can enable the provisions of tailored support. This is discovered to promote a safety while still upholding the um right and presence of the individual within the contents. For instance, a patient who has been ascertained to be at risk for through the risk assessment will however benefit from the systems which a care plan that includes the use of an assistive device aiding their mobility. This also is the care this is also the case with care provider which has the assessment to be risk injury due to frequent lifting of patients and promised mobility.
Did you
Um,
touch
the
base
so-
on what we call person-centered care?
yes,
Did you talk about
no,
it? That
I
you need
I
to talk about it.
about what
Person-centered care. Do you know about that?
person centered care. Yeah,
Yes.
I did.
Did you?
Yes, that's I talk about patients. A people.
Person-centered care.
Okay, person
Person,
centered care. That's person's PEC. PPE.
do you know about it?
Yes,
Well, how come you
person
didn't talk about it in your
persons.
examining how risk assessment informs care planning? How come you didn't talk about it?
Mm,
Hello?
I don't know.
If we are to examine how risk assessment informs care planning, how can you talk about this without not talking about person-centered care? Amisola, I need an answer.
I didn't. I talk about personal injuries.
But that's different from person-centered care. Do you know what is called person-centered care?
Yeah, like a protection to yourself while carrying out a care for someone.
No, no, that's not person-centered care. That's not person-centered care. We've identified that risk assessments are done to what? To mitigate
Oh,
the likely occurrences of harm or what hazards, isn't it? Isn't it?
yeah, yeah. I talked about person center
Yeah,
care.
so
I
once
talk
we've
about
spoken about person-centered care, once we've
yeah.
spoken about risk assessment, we can never talk about risk assessment in care without a person-centered care.
I talked about it. I read it out now.
So you are now reading about it.
Okay. I talk about the promote of person centered care. I said it is through the use of proportionate. I mean through the use of proportionate and appropriate safety measured.
So you have spoken about it.
Yes, I spoke about it. I said I talk about the um I talk about personal care, person center care.
Centered care, yes.
Yes.
So in care planning, any care planning consists about everything about the service user or the patient. Now, in person-centered care, we practice person-centered care because you need to surround yourself with all the do's and don'ts about the carer. It's the carer's, it's the patient's choices, okay?
Mm-hmm.
It's more to do with the patient's choices rather than what we want on the patient. Hence why if somebody refuses to take medicine, you cannot force him or her. You can
That's what we call as a duty of care.
duty of care is different from person-centered care. Duty of care is towards yourself and also the service user. But person-centered care is to do with everything that the patient wants is what you do for them. This is how they come up with a risk assessment to capture on the care plan. So the care plan will have what the patient wants. Most time you see a lot of things about the patient. What if he doesn't watch TV? Anything that irritates the patient is captured there. Okay. If he
Yeah,
wants cold tea or very hot tea, what time you have to turn the TV on or turn the TV off? Well, I like to go to the toilet alone or he needs somebody to join him or her. It is about what the patient, the assessment of the patient, what they want. Even the patient cannot even speak or is dead. His next of kin should be able to tell us what the patient is called person-centered care. And that's what we do in risk assessment. Okay. So risk assessment identify all the do's and don'ts of a service user to inform you, the carer, how to take care of the person per the person's choices. Okay.
yeah,
Do you understand?
yeah,
Good. And so if you have not threw more light on that, you need to do that in your
yeah,
okay.
yes.
So let's jump on. Let's go to 3. What do you have there, please?
Undertake a critical reflections of the effectiveness of health and safety policies
Policies.
and the responsibilities of management in relation of health and safety within the health and social care. Consideration should be given Consideration should be given to the promotions of positive health and safe culture.
What's your understanding, Sola? What's your understanding on
I'm
this?
trying to understand the
You don't
critical.
understand at all, eh?
I do have an understanding on
Some
that.
some bit of understanding.
Yes, on this number three actually.
Yes, that's
Understand
number
the
3.
critical reflections of the effectiveness of those health and safety policies and the responsibilities of management in relation to health safety within health and social care. Because I'm still on. Well,
Sola, I can see you are frustrated. What's the problem?
I think I did something else instead. Yeah, for
What did you do? What did you do?
for-
What was the question? What do you have there from your side? What was the question?
So the question here is they are saying that you should undertake a critical reflections of the effectiveness.
Effectiveness of these health and safety policies that you have mentioned. Don't
Yeah.
forget, in the one you mentioned them, don't you?
Yes.
Isn't it?
Yes.
Okay. And the responsibilities of the management in relation to the health and safety within the health and social care.
Yes.
Consideration should be given to the promotion of positive health and safety culture. Okay. So undertake a critical reflection of the effectiveness of these health and safety policies that you have mentioned and the responsibilities of management in relation to the word is responsibilities of management. Who are the management? The employers, isn't it?
Yes.
Good. In relation to the health and safety within the health and safety. Yes, of course. So you have effectiveness of this and the responsibilities of management. It is management who's supposed to have an oversight responsibility on this effect of the health. It's management, isn't it?
Yeah.
Yes or no?
Yes.
Good. And it says, so have a critical reflection of those health and safety policies that you have mentioned. How effective? Reflect upon them And then also the responsibilities of management in relation to this health and safety within the health and social care. So let's
Yeah.
reflect on the effectiveness of these health and safety policies. Are they
Okay.
effective? Let's reflect it. Let's reflect.
Yeah. I according to my own understanding, yeah, I think they're trying to ask how the effectiveness works,
Mhm,
how it's you know um
mhm,
like how the management try to make people safe.
mhm,
So if I'm gonna go back to my workplace, so
mhm,
um I'm like but because I was actually thinking of medication, like medication management.
I think the word is health and safety policies. Okay,
Yeah.
is medication part of health and safety policies?
Yes.
Is it part of it?
Yes. Like, yeah, because it's also under well-being.
Um, uh, you've done a unit when we talk about health and safety policies. Is medication part of it?
Yeah.
Have you gone back to read? Is it part of it?
Yes.
Oh, Gbemisola, your
No,
voice
no,
is
no, no,
low.
no, 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 no. No, like
Your
um
voice is low. Listen, you're running away from your answer, isn't it? I don't think it's part of it. Gbemisola,
yeah.
I don't think it's part of it.
How about manual handling?
It is part of it.
Yeah, because yes.
That is part of it. Mhm. I'm sure if you go to your units when you started, you should have known the health and safety policies. You should have known that.
Yeah.
Mhm. So having identified those health and safety policies says, reflect on how effectiveness are those. So undertake a critical reflection of those effect of those health and safety policies. And then in addition, what are the responsibilities of management in relation to those health and safety? Management played have a major responsibility for all those health and safety, don't they?
Yeah.
Good. They do, because they are the ones to have the oversight responsibility. They are the one to train, isn't it?
Yes.
Exactly.
Giving continuous training.
Continuous training. That is why every year we do training, don't we?
Yeah, continuous trainings and
CPD.
risk assessments.
Amazing. That's why we do CPD, continuous training, continuous, name them. Some of them we do appraisal,
Continuous
isn't it?
continuous training, continuous risk assessments.
Appraisals.
Yes, abusers.
Sometimes you need to assess and then even promote you to a senior carer and you need another training for it, isn't it?
Yeah.
Level 2 qualification, level 3 qualification, you name them. Sometimes you need clinical trainings as well.
Yeah.
At times, you have to assign you to a particular client, isn't it?
Yes.
What do you call, what's the name of that? Key worker.
Yeah.
We call them key worker. So you need to critical reflect of the effect of these health and safety policies and the responsibilities of management in relation to the health and safety within the health and social care. Considering that you should be given to promotion of positive, healthy and safe culture. There must be a safe culture. There must be a best way of doing stuffs. If you want to, if you want to
Thank you.
transfer a patient from the bed to his commode
Mm-hmm.
or his wheelchair, what do we use? Are they not best practices?
Yeah.
Isn't it?
Yes.
Don't we use the sheet?
The slicing sheets
Amazing. Amazing. I mean, this is our health and safety, but they have to follow the slide. Why do we use a sliding sheet?
to prevent the
Saws and marks
yeah,
and all that, don't we? Exactly.
Yeah.
Exactly. Exactly. Okay. We use a sliding sheet to roll them. And then sometimes you use a transfer to transfer them onto the sometimes you use the Zimmer frame first before you transfer them to the wheelchair, isn't it?
Or we use hoist
Or
for
use hoist.
transferring them.
Amazing. For somebody who is bed bound, isn't it?
Yeah, we
We
use
use hoist for somebody who
we
cannot
hoist
move at all.
us. Yeah.
Yeah, we hoist them. But that you don't use special, you use sling.
Yeah.
All right.
Yeah.
We use the sling. The sheet is just to roll them, but then the sling is what you attach to the hoist, isn't it?
Yes.
To lift them up onto the accommodation or the toilet seat or everywhere you are taking them.
Okay. Yeah.
So these are all health and safety stuffs just to prevent people from falling down and all that.
Yeah.
Aha, very important. Even their position. Aha. So these are things that we tend to look at when we say health and safety policies. We tend to look at those the environment, like you said. The
Yeah.
environment should be free from any slippery floor, isn't it?
Yeah. Anything that will cause hazard to them, that will
Exactly.
cause injury. Yeah. Yeah. Any hazard.
Exactly. Slippery floor, nothing on the floor that can pierce
Yes.
somebody's shoe or something, or the
Yeah.
patient's. And health and safety is not only for the patient, it's also for the support workers, isn't it?
Yes.
Exactly. So these are the things that you need to look into in your submissions.
Yeah.
Okay? Well understood?
Yes.
Are you
Thank you.
sure?
Yeah.
Very confident?
Yes. I'm trying to write out some points I can attach to my assignment.
Amazing. 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 You should use and cite a range of academic and reliable um, sources. You know, you use the Harvard references, don't we?
Yeah.
Good. And then a comprehensive Harvard star reference list must be included in the end of your work.
Yes.
Report should be 1,500 words, risk assessment 750, essay 750.
Mhm.
Are we okay?
Yes, we are.
Any question?
No question.
Are you
So
sure?
yeah,
Has it
I'm
been
good.
has it been fruitful?
Yes.
Sure?
Yes, it has.
Amazing. Amazing. When next are we meeting?
Um, we're meeting next Sunday, and I would love it if you can still be the one that they'll be bringing next Sunday. Because
Oh,
the
tell
most
them, tell the office.
the most tutors I've been having, I've not been hearing what we've not been communicating this much. If you can go through our meeting with them, because I have to ask them to type and do this. There was a lot of and that also drives me away from coming for
Oh,
tutor,
oh.
because I don't hear what they say. I was just telling
Why don't
my
you hear what they say?
I don't know. I just have to pay. I have to listen. The time I use for listening alone is enough. I listen. I hear
What
what they
was your
say
first, is it
very
Anita, your first lecturer?
was um I can't remember his name, but I think he's from India.
Anita, the woman?
I think he's from India and he's a man.
Oh, it's a
He
man.
tried
Okay.
his possible best to make sure I get everything. But trust me, I was just it got to a stage I have to, just act like I do. I didn't really I didn't really get all this
Okay. And then your second lecture.
no, I only had first one, so because I thought it's gonna be the one to be taking it, so I just like, don't worry, I'll be fine without a tutor. But then again, I need it because just like we've been talking now, I've jotted out some points I actually need. His name is Suhon. I can't pronounce his name.
That's fine.
His name starts with S. Amendip.
Is
Amandip.
it?
Amandip.
I'm on deep.
Mm.
Was it on health and social care?
No, 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 no. In the introduction, that was the first introduction about the course
Okay.
and all that. This is the first time I'm having tutor on this thing, so I think for the next meeting, we'll be having it on um, on the next course. I'm trying to
Okay,
see.
that's fine. No worries. I'm sure. I don't know if you're on WhatsApp group with me or something. Any issues at all, you could
No,
send me a message. I don't know if you're on any WhatsApp group or something.
no, I'm on WhatsApp group. I think the group is for general. I don't know.
The general, the level six group.
Yes. No. 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 I'm on yeah, the level six this thing. I think it's the WhatsApp group. Yeah, I think so. This. Yeah. Yeah. Because it shows that you invited me for this thing. I just put hello.
Okay.
I don't know which one is your number, but yeah, I'm on the WhatsApp group. Oh, Raman just replied, so I'm on the WhatsApp group.
You're on WhatsApp group. Okay. Then I'm sure I should be there. Sure I should be there. Since I'm teaching you, I'm sure I should be there. I'll try to chase you. Do you have the same name on the WhatsApp group?
Yes,
Okay, I'll see if I can trace you there.
I have a picture of a man on. That's my dad on the WhatsApp.
Oh, is it? Okay.
Yeah,
That's fine. I'll trace you with that name and see. Okay. If you have any
yeah,
issues at all, so you could message me. But it's been fruitful discussions in here. And just take note that there are some key things that at least we expect you to have on
yeah,
your
yeah,
yes. I mean, care, person-centered care. These are things that when somebody is marking your assignments, you know what I mean? Few things that
yeah.
they can really say, oh yes, Sola knows what he's talking about, few things. Yeah, very, very important. So risk assessment.
I draw out some plan on that.
Hmm.
I draw out some points I need to add that will bring more light to the whole write up, and I really appreciate that. So I think this next Sunday we'll be talking about the management of health and social care, right?
Uh-huh.
I think this next week Sunday is what we'll be talking about is management in health and social care.
Yes.
Yeah. All right.
Yeah, that's true. All right.
Yeah.
Yes. And so I was in another lecture. I just completed. That's why you were waiting. I have a lecture between 2 and 3.
Okay.
And then
So
yours
this
was 4. But then we had to delay because I was taking them through project work and they were asking there were lots of questions and I could not leave them. So
I understand.
yes, I was telling them to have another lecture with you, but we couldn't conclude early and quickly.
No,
Once I
I
was done,
understand.
I have to join you yet. So, but you have my number on the group as well, I'm sure. So if anything, you can message me.
I can't find your number because on the group they've only got 5 members, and the numbers
Then maybe
were
they've not added me yet.
yeah, maybe.
Maybe they've
Because I
not added
wouldn't
me
mind
yet.
if you can teach me again, if you can tutor me on the next the next event. But they haven't
Mhm.
created this thing for that.
Is it?
Health and safety. Anyway, my next this thing is management in health and social care.
Mm-hmm.
Yeah,
Is it?
that's the next tutor. That's the next course I want a light on because I haven't started with that yet.
You haven't, right?
Yeah. I only have two more courses to go because I'm submitting this one by Tuesday because I'm not sure I can submit it on Monday again because I have some things I need to add to.
Mm-hmm.
I'll be submitting on Tuesday by God grace.
Okay. Um, it's fine. I was checking the group number. I'm sure they've not added me on that group, and I'm supposed to be on, but let me see something. Let me see like 1 minute. Level 6 L6. Let me see the 6 group. Level 8 TSC level 3. Level 3, level 3. Let me see this one on unit. Sorry. Yes. So let me see. I'm on it, but let me see. Are you the one? Hi, Bemisola. Are you the one called Shabby?
Yes, Shabby.
Okay, that's fine. All right.
Yeah, yeah, that's me. Oh, you are on the group too.
I
You
know,
are
yes,
there.
yes, because I lecture for all groups, so I know I'll be there. Just that I might be there, but I won't be active because if I don't have any, you know what I mean? I've been
Yes.
there for years. Because if I don't have any lecture to deliver, you wouldn't hear of me. But I've been there for years. I've done, yeah, I teach across. So since I knew I was there, but I couldn't find you. I have two numbers, so I've just checked and I realized that
Okay.
they've just added you. So that's fine. I've messaged you if anything at all. Okay,
All right, sir.
you could if you've done assignment, you need any observation, whatever to guide you. Do not
Yeah.
hesitate to let me know. It's no problem. Okay.
All right, sir.
You were Kara. You're also in Manchester, right?
No, 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 no. I live in the UK. London.
Oh, you are
So
in London. Okay, that's
yeah.
fine. That's fine. That's fine. So I would and so let's see. So see level 3. Let's look at level 3. So you look at that. It say explain how health and safety policies and practices are monitored and reviewed. Okay, look at
Yeah.
that. That's a 3. Analyze the effectiveness of health and safety policies and practices in the workplace in promoting a positive, healthy, and safe culture. And then
Mm,
3.3, examine the responsibilities of individuals in relation to health. And this individual, they are talking about management. That's what they said. Okay.
mm-hmm.
But when it comes to health and safety, it is not only management that have responsibility, isn't it?
Mm-hmm.
The
Yeah.
employees also have, don't they?
Yeah, you do.
Exactly. So these are some of the things you can argue. You can in your presentation you can look at to management as to management and then also the normal staff also have responsibility. You understand?
Yeah.
Oftentimes they tend to have health and safety officers, isn't it?
Yeah.
Exactly. So you can talk about the health and safety officer who is the key person in charge for the entire, and then you normally also have safeguarding officers, don't they?
Mm-hmm.
But the health and safety is a responsibility for everyone. Am I right?
Yes.
Amazing. So these are some of the things in the examining. The word is examine, okay? So you look at all
Mm-hmm.
those things. All right.
Yeah.
All right, so lovely speaking to you.
Yes. Nice speaking with you.
Yes,
Thank you so much
give me
for
your
your help.
feedback, please. Since you have
Yeah.
enjoyed the lecture, I need your feedback, please.
Is he on the WhatsApp or where?
No, leave it on the Zoom, the chat room, and then put one
All
also.
right. All right. All right, sir. Thank you so
Leave
much
it
for.
now because I won't end the session. So leave it now before.
Is he on the chat?
No,
Oh,
no, no. You see
reaction.
the chat where you put your full name.
On the chat or the reaction?
The chat. You know where you captured your full name?
Yeah.
Yes. Where does the reaction go?
I'm coming.
Okay. And when you're done with this, then you can put one on the WhatsApp group, okay?
Yeah.
That will be seen by everyone. How you enjoyed today's lectures and
The reaction is also on this thing. Very good. Right.
good. Okay. Have you then you can run put one on the group as well, okay?
Yeah.
Okay. So am I okay to learn the lecture to end the lectures now?
Yes. Thank you so much for your time.
You're welcome. You're welcome.
Thanks.